It's just an agonizing pain that it feels like there's no end in sight from. My hands would go numb driving down the road, and it's not a numbness that like your foot goes numb. It's a burning sensation. And there's no relief from it. Ice won't take it away. It will wake you up from a sound sleep. Doing different activities, riding this big guy right here, they would just go numb, and you don't feel like you can hang on, or it makes it hard to drive.
Yeah.
So office-based hand surgery is really something that's a new technique developed in a combination of factors. One was an anesthesia technique developed in Canada in which they determined that you can use a local anesthetic that contains a material called epinephrine. Epinephrine is what prevents bleeding. We realized that we could do operations under local, simple operations in the hand, and we would typically use a tourniquet. But now we've changed to where we use this material, allows us to avoid the use of a tourniquet and prevent bleeding, and can be done in an office setting very safely and very efficiently.
Everything's going fine.
Good.
Many patients are actually pleased when we tell them that we use a local anesthetic, that there's no sedation involved, that there's no diagnostic testing, that they can come in for their surgery, go home the same day, in fact can work the same day in many instances. It's obviously very appealing to them because they don't lose money from their employment. They don't have to have a family member bring them in because there's no sedation provided. We explain the technique of where we inject the area first. That technique is equivalent to a dental injection. The injection then has to set up for about 25 minutes before we do the procedure, and that's when we take the patient back to the procedural suite and prep the area and perform the surgery. In terms of the timing of the surgeries, the carpal tunnel release itself takes about 10 minutes, trigger finger about 7 to 8 minutes, de Quervain's tendon release about 15 minutes, and then when we're removing little masses from the finger, it takes about 10 to 15 minutes. The patient is awake throughout the procedure. They don't feel any pain or discomfort. What's interesting is many patients are intrigued and actually want to look at their surgery and are grateful for the opportunity to kind of look and see what's being done.
I love the way my right hand feels. I wish my left hand felt that good already. I'm looking forward to having the left hand done so I can get back to normal activities, go back to work, get back to riding him. That's been the hardest part, is not being able to ride.